A look at a disease affecting millions of people, asthma. Here's reporter Laura Windsor.
Any age can suffer from asthma, and there are several factors for its cause. Often those with asthma underestimate the severity of their condition, resulting in damage to their airway and even death. We spoke with pulmonary and critical care specialist Dr. Jack Stewart from St. Joseph Hospital in Orange.
Asthma is a disease where the airways are hyperresponsive to stimuli, and the airways become inflamed and narrow down, and the patients have difficulty breathing. There's different triggers for different patients. In some people, asthma is an allergic disease, and there may be a specific antigen that triggers asthma attacks. That's more common in the pediatric population. In adults, it's more common to have just generalized airway hyperreactivity. You might respond to paint fumes or perfumes, or if you have a viral respiratory infection, then that may bring on your asthma. There's a number of different triggers. Asthmatics will usually have, well, if they're asymptomatic, they'll have a normal exam. If it's in the during the course of an attack, they may wheeze. If the attack becomes very severe and they're prevented to the emergency room, you may hear them move very little air at all. Chest X-ray is usually normal, although during the course of a bad attack, the lungs can start to look a little big because it gets hard for the asthmatics to blow air out of their lungs. Asthma is variable in different patients. It occurs probably most commonly in children, and in some children, by the time they reach adulthood, their asthma is resolved. In other people, it's an episodic disease where they'll be essentially normal in between attacks and then have periodic attacks. In other patients, it's a chronic disease where they'll have symptoms frequently, and depending upon how many symptoms you have and how much trouble you're having, it sort of directs how aggressively that you treat the asthma. If someone has mild asthma, they're usually treated with a meter-dose inhaler with a sympathomimetic, and they just take a couple puffs of the meter-dose inhaler as needed. If they don't need to do that more often than several times a week, and the asthma doesn't wake them up frequently at night and they don't have much trouble, then that's all they need for treatment. If the asthma is a bit worse and they're having to use the sympathomimetic frequently, then we add anti-inflammatory medicines like inhaled corticosteroids, or the other anti-inflammatory that's now frequently added is a leukotriene inhibitor like Xyluten or Singulair. The treatment of asthma is evolving a bit all the time. I mean, I've been in practice about 18 years, and we have some medicines now that we didn't have 18 years ago. There is a new medicine that looks like it will be effective in treating allergic individuals with asthma, where it's actually an antibody against IgE. I haven't given that yet except in clinical trials, so it's just been approved, and we'll probably be using that in some individuals. There's new medicines coming all the time. There's no way of preventing asthma, but part of the treatment now for asthma is to try to prevent new episodes, and that's why anti-inflammatories are so important in the treatment of asthma, either inhaled steroids or leukotriene inhibitors. There is no known medicine to really prevent asthma at this point, though.
Whatever the age of the patient and the severity of the difficulty in breathing, asthma is a disease that many of us must deal with. This is Laura Windsor for the American Health Journal.